Okay, Tracy, so we're going to talk about IBS right now. So could you start off by just explaining what IBS actually is and what IBS means?
Yeah, IBS means irritable bowel syndrome, and it's not a disease per se, it's actually a collection of symptoms, and they include bloating, diarrhoea, constipation, abdominal cramps, which have gone on for around about a 3-month period, and that can be intermittently.
Okay, and you're telling me before we came on camera that you see a lot of people that have been through the National Health Service without too much success. So, why is it that they should come to you, given that the NHS has probably struggled to help them with their IBS?
Yeah, I think IBS is a very difficult condition for a GP to deal with, simply because the types of medications that he has to hand and the types of things he can help with are really palliative measures designed to suppress a symptom as opposed to finding the underlying cause of somebody's irritable bowel syndrome.
So how do you go about finding the underlying cause?
I find underlying causes by clinical testing, often following the completion of a very comprehensive questionnaire which will give me some really big clues as to whether the person that I'm working with has an issue with not being able to digest effectively, a diet too high in refined carbohydrates or readily fermentable carbohydrates, an inability to digest through lack of stomach acid. Sometimes there can be an overgrowth of various types of critters, as I call them. Most famous of all that everyone seems to know something about is Candida, which is a yeast overgrowth. But you can have a bacterial problem, you can have a parasitic infection. Many people with IBS have all three. And increasingly now, I'm discovering that a lot of IBS sufferers have SIBO, small intestinal bacterial overgrowth.
Okay, so describe the kind of results that you could get for somebody that comes to you suffering from IBS.
The kind of results are that you can get a complete cessation of their symptoms because you address the underlying cause. So if somebody has a diet which is high in fermentable carbohydrates, then they will be very much more comfortable avoiding fermentable carbs for a while, and also dealing with the underlying cause of that. Getting rid of Candida and bacteria can mean that the person's symptoms go away and don't come back.
And is that a relatively quick process?
It's not instant, and it's not as quick as I would like, and certainly not as quick as my patients might like. And it's not without a lot of hard work on behalf of the patient. So, typically, people come to see me and I would say that they are substantially better on the second follow-up appointment. I quite often will get someone to make dietary changes from the very first meeting, meaning that within a few days of the first appointment they might be feeling substantially better, and that is if the reason for their IBS is diet related, or for the most part is diet related.
Okay, so the good news is you're saying that you can help people with IBS, but it's very much around a partnership approach, that they have to become really active in helping themselves.
Yeah, absolutely, that's right. I work in a very collaborative fashion. I consider that myself and the patient are on the same side. It's us versus the IBS. And the people that do the best are the people that are prepared to make the changes, at least give something a go. Quite often, the dietary changes involve someone needing to cook some different style foods for the first time, getting to grips with actually what carbohydrates are and what fermentable carbohydrates look like, and really putting in a bit of their own time and their own research and doing a bit of their own homework. And those type of people do very well indeed.
Okay, great. So if somebody's watching us this afternoon, wants to find out a little bit more about how to get in touch with you, how can they do that?
They can get in touch with me in a variety of ways. The website has a lot of information on it, so perhaps a good starting point would be to give that a good read over, and then if there are any questions, by all means fill out the web inquiry forms on the website or give me a call. I will always chat with people for 10-15 minutes just to understand what's going on with them and to give them some guidance as to kind of where we might go next.
And they can find that
at www.ibsclinics.co.uk.
Fantastic. Thank you, Tracy.